Most of the time in social science and in medical research, we are looking for causality. We're looking for why event A predicts event B because we understand what happens between A and B. And in biomedical research, for example, that might be referred to as the mechanism. One of the trickier parts of big data is we are often sufficiently advanced from a business point of view by having correlation alone. All we know is that this and the other thing tend to happen at the same time. We often have no idea why, and we don't spend much time trying to understand why. We just understand mathematically that with a very large data set that's refreshed very quickly, that this observation holds true over time and is predictive in value. Just as another example of how that can be put to use, one of the, I think, most disappointing things for folks in the health field is when you do manage to get the right patients into the right clinicians for the right diagnosis and the right therapy ends up being a pharmaceutical, which is the case, of course, with hypertension, oftentimes with diabetes. What you really need is for the patient to actually fill a prescription and actually take the medication as prescribed. And there are a disturbing number of cases where that last step doesn't happen the way the medical world would assume that it would happen. So you definitely have somebody who's been properly diagnosed, properly prescribed, they have a prescription, they fill the prescription, but then for one reason or another, they don't comply with the administration of the medication. That is, they don't take it every day or they don't take it with the right frequency. And that's pretty disappointing because so many things have gone right in that process, but the one critical where the rubber meets the road, are they engaging in the therapy, is not happening right. Now there were folks this year at Datapalooza who are working on models that are helping clinicians and health organizations with higher levels of accuracy predict who will and who will not follow their prescribed medications. And by sorting them out in a mathematically adequate way, they can focus the scarce resources on follow-up with those people who are most likely to need that follow-up in order to comply with the prescription, and not waste resources on those who are most likely to have the self-discipline to go ahead and follow through on their own. So that's an example of predictive analytics where I have no idea why the factors they've chosen are indeed predictive of who will not follow through on their medication, but I know it's valuable in a clinical setting, especially when the social insurance reimbursement schemes are moving more toward health status and away from services provided. It will be of economic consequence to the providers that they're able to address that follow-up to the folks most likely to need it, and the big data and analytic methods allow those folks to be identified as opposed to treating everybody to the same text message or the same phone call. It allows those messages to be customized. So there's a whole lot of good that can be generated from a business perspective, even in instances we don't quite understand why the data we're looking at is predictive of this behavior. It's valuable to know that it is predictive of that behavior, even if we continue to puzzle a little bit on why it would be so.